Good morning, everybody. My name is Pavla Vaneckoba, and I am going to show you some of the outcomes of my research on heat, on impact of extreme heat on human health. And this work has been done together with the previous presenter, Hilary Bambi, at the Center for Health Research at School of Medicine, University of Western Sydney. So most of us may not think that extreme heat is dangerous to us. However, it presents a significant risk to human health. Heat-related injuries and death are highly treatable and preventable, but they continue. Extreme heat continues to affect directly and indirectly our health and results in significant heat injuries and death. Yeah.
Can you get a little bit closer to this?
I'm sorry. So, as you can see, heat waves have caused a significant increase hospitalizations, heat-related injuries and death, nationally and internationally. In Australia, we had its own share of heat waves in the past decade or so. The most damaging and the most in our memory is the 2009 heat wave in Melbourne that resulted in approximately 370 deaths, extra deaths. We are all at risk from heat, but some of us are more vulnerable than others. On the pictures are some of the vulnerable populations. These include the very young ones, the elderly and immobile, also homeless people, because they don't have access to air conditioning. They don't have in many cases, access to drinkable water. They tend to have a pre-existing medical conditions. Other vulnerable groups include the social isolated people that sometimes don't have access to help or don't have the help available to them. Also, the younger population can be affected by heat. These outdoor workers, from obvious reasons, and people who tend to exercise intensively on hot days regardless of the heat and the danger that it can present to them. The last mentioned group is the poor people that tend to also have a pre-existing medical conditions or they're more likely to live in hotter areas of the cities, and they most likely or more likely are not having access to a working air conditioning. So we have very simple main two questions that my research looked on in Sydney. So we looked, have there been many more people admitted to hospitals on extreme hot days in Sydney? And if so, what were the characteristics of the people in terms of age, gender, and pre-existing conditions that were different from the population that was admitted on non-hot days? So for this research, we used 18 years of data from 1991 to 2009. We obtained hospitalizations for some of the medical conditions that were previously associated with extreme heat. These include cardiovascular, respiratory, renal, and mental diseases, diabetes, dehydrations, and effects of heat and light. That's the title for generally the heat stroke, heat exhaustion, and there are others. We use daily average temperature to measure the heat impact, and we also adjusted for relative humidity because it also tends to play a role, significantly important role in the impact on health. And we also obtain air pollutants, ozone and PM10, because they tend to be in a higher concentrations on hot days due to the optimal conditions that occur on these days. So let's look at the methods. So how did we select our extreme days or hot days? Well, there is a number of ways that we could select, and the number of ways that have been used to select the hot days or these oppressive days. And in our case, we defined extreme days as a days with temperature above the 95 and 99% of the record. So these were the hottest days during our study period. And we then match these extreme days with the non-extreme days that were occurring close by day of the week, and compared then the hospitalizations on a case days in comparison with the non-hot days. We calculated odds ratios of the probability of admissions on past case days versus control days, and the model was adjusted for relative humidity, ozone and PM10, and holidays, public and school holidays. So what we found when we compared extreme days with non-extreme days was that obviously they were hotter, but they also had a higher higher concentrations of pollutants, ozone and PM10, and they were relatively drier. There was a lower level of relative humidity. So these are our main results. We found that some of the admissions during the case days were significantly increased, and these were admissions due to respiratory, cardiovascular, and mental diseases, also due to diabetes, volume depletion, which is dehydration, and effects of heat and light, which is heat stroke and heat exhaustion. When we look at these admissions a bit closer, and we actually subset the big group, for example, the mental diseases, we found that psychosis, for example, were sharing the highest risk from all the mental diseases. This could be possibly because of the behavior of people, or because of possibly medications that they are taking. Other subgroups important that were acute, other diseases of the upper respiratory tract, and actually some of the subsets of respiratory diseases were lower. The admissions were lower, significantly lower, and these were for asthma. Once we looked at the main disease groups, we also wondered whether different age groups are affected differently. And in accord with international research, we found that the elderly were the most vulnerable group, but also some of the young adults and adults. For example, for the diabetes, the generally younger adults were significantly likely to be admitted to hospital. For heat stroke, there was the relatively younger group, but also the elderly and younger group also were vulnerable for dehydration, respiratory, and some cardiovascular age groups. So in summary, extreme days in Sydney were characterized by higher temperatures, lower humidity, and higher air pollution levels. People with cardiovascular, respiratory, mental, and heat-related diseases, diabetes, and dehydrations were more likely to be admitted to hospitals. Surprisingly, we haven't found that hospital admissions due to renal diseases increased on hot days. These have been found internationally at some of the, and locally in, for example, Adelaide, but we didn't find those results. Some subcategories of respiratory and mental conditions accounted for higher risk than others, and younger adults and the elder were also more likely to be admitted on extremely hot days. Those very young didn't seem to be affected from our results. Thank you.